welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni. Then let's look at today's top headlines. Death Certificate Guidelines by Tamil Nadu Medical Council. Referring to the fact that death certificates serve the critical functions of providing documentation for legal or administrative purposes and vital statistics for epidemiologic or health policy purposes, the State Medical Council in Tamil Nadu has issued an advisory for the doctors in this regard. The council also reminded the registered medical practitioners in the state that issuing death certificates can have medical legal implications, and therefore a doctor should only provide a death certificate if he or she has attended the deceased while alive, or he has attended the patient within 14 days before death, is satisfied with the reason of death. National Board of Examination launches 14 new DNB and FNB courses. Application starts from 15th April. Through recent notice, the National Board of Examination has informed about the launch of 14 new DNB and FNB courses by NBEMS. According to the notification, 13 are FNB courses and 1 is for DNB candidates. NBEMS shall be inviting applications for the 14 courses from 15th April 2022. The information bulletin containing the details regarding the minimum accreditation criteria, application fee and other relevant information shall be available at NBEMS website. The application forms have to be submitted only in online mode through online accreditation application portal, which can be accessed through NBEMS website. For more details, you can check medicaldialogues.in. Delhi COVID cases at 40-day high of 299, up to 48% in 24 hours. COVID-19 cases in Delhi touched a 40-day high on Wednesday, with 299 persons testing positive for the viral infection in the last 24 hours. This comes a day after daily cases in the capital crossed 200 for the first time since 10th March, with a tally of 202 fresh cases. The last time the city had lodged a higher daily count was on 4th March, when 302 cases were recorded from 47,738 tests. According to health bulletins shared by Delhi government, only 43 COVID beds out of 9,745 were currently occupied in the capital. The most common symptoms being seen in patients are fever, runny nose and fatigue. In some cases, patients are also having diarrhea and other gastrointestinal symptoms. Doctors at Rheumatology Conference at KIMS Hospital said that children too are being affected by rheumatoid arthritis. The conference provides a continuous update of current clinical practice. The motive is to keep all informed of the latest developments and current recommended practice in the rapidly advancing fields. Department of Clinical Immunology and Rheumatology, KIMS Hospital, organized Clinical Rheumatology Conference on 9th and 10th April 2022. The conference highlights selected clinical cases with an emphasis on case-based approach, problem-based learning, and eminence-based discussions by renowned rheumatologists. The chairperson of conference was Dr. B. Bhaskar Rao and Scientific Committee Chair Professor Amita Agarwal. Rheumatologists in conference said that children too are being affected by rheumatoid arthritis. Rheumatoid arthritis, or RA, is an autoimmune and inflammatory disease, which means that your immune system attacks healthy cells in your body by mistakes, causing inflammation in the affected parts of the body. Rheumatoid arthritis mainly attacks the joints, usually main joints, at once. Rheumatology is not understood even by adults. Children cannot express themselves well regarding these issues, but they also can get arthritis. Stiffness in hands and legs, long fever, and reduced eyesight are some of the symptoms which must be checked by a rheumatologist, said Dr. Suma Balan, pediatric rheumatologist at the conference. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.